Gas exchange and oxygenation. The lungs provide the body the ability to exchange the gases carbon dioxide and oxygen between the tissues and into the bloodstream. They also work with the circulatory system to carry oxygen to the cells and remove the carbon dioxide. The pharynx is subdivided into the nasopharynx, or the nasal area, and the oropharynx, which is the throat or the mouth. This will warm, filter, and humidify the air. The larynx is the vocal cords. The lungs are linked to the nervous system, the parasympathetic and the sympathetic nervous systems. They are responsible for bronchoconstriction and bronchodilation. The lungs expand and contract smoothly because of the pleural fluid that is produced in the pleural cavity. The diaphragm is a muscle that separates the chest cavity from the abdominal cavity. This is controlled by the autonomic nervous system. Surfactant is a lubricant that keeps the alveoli from collapsing. A lack of surfactant will allow the lung tissue to collapse, creating volume loss during expansion. This is also known as atelectasis. Ventilation is the flow of air inside or outside of the alveoli. Oxygen is transported into the alveoli and carbon dioxide is removed. Perfusion is the flow of blood by the cardiopulmonary system into the capillaries. The brainstem monitors the oxygen demand and carbon dioxide. It signals the respiratory system to respond. Lung compliance is the point where the lung can expand to respond to the increased pressure within the alveoli, or interalveoli pressure. Inspiratory reserve is the amount of air that is breathed in after inspiration. Expiratory reserve is the amount of air expelled after a breath. Tidal volume is the amount of air inspired and expired with each breath. Residual volume is the amount of air that is remaining in the alveoli after expiration. Forced vital capacity is the amount of air expelled from the lungs in 1 second during forced expiration. Vital capacity is considered the maximum amount of air expelled after maximal inspiration. Total lung capacity is the amount of air that is remaining in the lungs after maximal inspiration. The cardiopulmonary system is responsible for oxygen transport through the arterial circulation process. The red blood cells, or erythrocytes, transport oxygen and hemoglobin. The blood leaves the right ventricle deoxygenated. It is then routed to the pulmonary artery and into the pulmonary arterioles to the pulmonary capillaries. This is where gas exchange occurs for oxygen and carbon dioxide. The blood is oxygenated in the pulmonary capillaries. It then moves to the pulmonary veins and is returned to the left atrium. From the left atrium, the blood enters the left ventricle, is pumped into the aorta, and through the systemic circulation. During diastole, the mitral and tricuspid valves permit the blood to flow from the atria into the relaxed ventricles. During systole, the mitral and tricuspid valves close, then the aortic and pulmonic valves open. The first heart sound, known as S1, is heard during the systolic phase. This is when the mitral and tricuspid valves open and blood flows to the ventricles, the aorta, and the pulmonary artery. The mitral and tricuspid valves will remain closed as the blood moves forward. Pressure in the ventricles decreases with emptying. The aortic and pulmonic valves closed, and this is the second heart sound that is heard, or S2. Cardiac output is considered the volume of blood pumped by the left ventricle in 1 minute. Cardiac output is regulated by the heart rate and the stroke volume, and this ranges from 4 to 6 liters per minute. The stroke volume is the amount of blood that is ejected from the left ventricle during a contraction. Stroke volume is affected by preload, afterload, and contractility. Preload is the amount of blood in the left ventricle at the end of diastole before the next contraction. This is also known as end diastolic volume. The afterload is the amount of resistance the left ventricle must work against to eject the blood. Electrical conduction originates from the SA, or sinoatrial node, in the right atrium. This is the heart's pacemaker. The electrical impulses move from the SA node to the AV node, to the bundle of His, to the right and left bundle branches, and then to the Purkinje fibers. This electrical conduction is responsible for normal sinus rhythm. This is the expected heart rhythm for adults. Dietary habits identify the risk of developing impaired cardiopulmonary functioning. Exercise benefits include improving blood circulation and strengthening the heart muscle. Exercising 30 minutes daily can lower the risk of cardiopulmonary disease by decreasing the blood pressure and cholesterol limits. This achieves and maintains a healthy weight. Smoking, either first or secondhand smoke, has various adverse effects on cardiopulmonary function. Stress, either prolonged or unmanaged, can negatively affect healthy cardiopulmonary functioning. It can raise the blood pressure by triggering the fight or flight response. This is the sympathetic nervous system. This will cause cortisol release from the hypothalamus of the brain and increases the heart rate. Increased cortisol levels and decreased metabolism of fat during stress will increase the weight gain. Environmental factors like pollution increase the risk of developing impaired cardiopulmonary functioning by damaging the lung tissue. When considering the client history, a nurse will look at medical history, family history of cardiac or pulmonary disease, medication history, social history, which is alcohol or tobacco use, employment history, the home environment, as well as any recent travel history. Objective data. This is a general overall survey that includes the individual's overall appearance, level of consciousness, signs of distress, the weight, their breathing, hygiene, vital signs, including oxygen saturation. First, the nurse will use inspection, noting the breathing pattern. The expected breathing pattern should be regular and quiet with no signs of discomfort. Signs of difficulty breathing would be the use of accessory muscles, restlessness, or cyanosis, clubbing of the nails, or edema. Jugular venous distension relies information about pressure and blood volume in the right side of the heart. To assess for jugular venous distension, or JVD, the individual should be reclined at 30 to 45 degrees with their head turned slightly away. Using a ruler, the jugular vein is measured from the sternal notch to the highest point of pulsation. If the measurement is greater than 1.5 inches, this will indicate abnormal distension and increased central venous pressure. For palpation, the nurse will assess carotid and apical pulses simultaneously to assess and compare regularity and timing, ensuring that the correct rate is observed. The nurse will palpate the thorax for tenderness, respiratory excursion, and tactile fremitus. The bilateral upper and lower extremities are palpated for skin turgor, temperature, capillary refill, edema, and pulses. Edema of upper and lower extremities is assessed on a 4-point scale. Capillary refill is assessed in the nail beds of the fingers and the toes. It should be no greater than 3 seconds. The pulses of bilateral upper and lower extremities are assessed for rate and quality. These pulses include the radial, brachial, femoral, popliteal, dorsalis pedis, posterior tibialis. For percussion, an advanced practice nurse will assess the cardiac border and identify any abnormal accumulation of fluid in the lungs. For auscultation, this is both the heart and the lungs. The lungs are auscultated anterior, posterior, and at the flanks to identify any abnormalities in the lung fields. Normal breath sounds are bronchial, and vesicular sounds. Bronchial sounds are heard over the trachea and the bronchi. Vesicular sounds are heard over the lung tissue. There are various abnormal sounds that may be heard. Crackles indicate fluid filling the air sacs. This is a popping and a crackling sound. Wheezing is whistling or a musical sound heard on exhalation. Bronchi is a rattling that is caused by an airway obstruction. Stridor is similar to wheezing. It is caused by a constriction in the upper airways and is heard on inhalation. This is considered a medical emergency. The heart sounds that are expected are S1, which is the lub, and S2, which is the dub. S3 and S4 are referred to as gallops and are additional heart sounds. An S3 gallop in children is considered benign. In adults, this is an indication of heart failure. During auscultation, an S3 gallop will sound like Kentucky, and an S4 gallop will be heard as Tennessee. Hypoxemia is a decreased amount of oxygen in the blood. This can lead to hypoxia. Signs and symptoms would include confusion, irritability, and restlessness. Hyperventilation is an increase in the rate and depth of breathing. This indicates an increased amount of carbon dioxide is being exhaled. Hypoventilation is shallow breathing with a much lower than expected respiratory rate. This causes too much carbon dioxide and not enough oxygen for the individual. Hypoxia is a lack of oxygen at the cellular level. This is due to a low number of red blood cells to transport the oxygen. Decreased diffusion is caused by COPD and pneumonia, poor tissue perfusion, and decreased ventilation. Disturbances of electrical conduction. These are electrical impulses that are uncoordinated. These are due to either conduction abnormalities or arrhythmias, also known as dysrhythmias, or both. Bradycardia, the heart rate is less than 60 beats per minute. Bradycardia may often occur in athletic adults, and it is considered normal if the individual is asymptomatic. The heart during bradycardia is unable to pump effectively for individuals that are not athletic. So the tissues of the body does not receive adequate oxygen-rich blood. Tachycardia is a heart rate that is greater than 100 beats per minute. The heart beats faster than expected and not able to pump enough blood to the organs and the tissues. Atrial fibrillation is a rapid, irregular heartbeat that starts in the atria. This is triggered by signals from outside of the SA node. The AV node becomes overwhelmed, and the atria do not contract but quiver, causing blood clots to form due to blood pooling in the atria. Ventricular dysrhythmias. This is when electrical impulses begin in the ventricle. Examples would be ventricular tachycardia and ventricular fibrillation. Ventricular tachycardia is an arrhythmia that is caused by electrical signals coming from the ventricles. The heart chambers are unable to fill with blood. This results in blood not being pumped adequately to the lungs and the body. Disturbances of mechanical function can lead to decreased cardiac output and altered tissue perfusion. Examples of mechanical dysfunctioning would be heart failure, valvular disease, and myocardial ischemia and infarction. Heart failure is the inability of the heart muscle to provide adequate cardiac output. This deprives oxygen to the body. This can affect either the left side, the right side, or both sides of the heart. Left-sided heart failure affects the left ventricle. This alters the heart's ability to pump blood to the body, causing blood to back up in the pulmonary veins instead of being carried away. Signs and symptoms may include hypoxia, crackles in the lungs, and shortness of breath. Right-sided heart failure affects the right ventricle. The heart is unable to effectively pump blood to the lungs, so the blood begins to back up into the systemic veins. Because of increased pressure in the veins, the fluid will leave the veins and enter the tissues, causing edema. Edema is often common in lower extremities, but may also occur in the genitals, the organs, and the abdomen. For valvular heart disease, the heart valves become leaky, not fully closing, also known as regurgitation. Regurgitation causes a backflow of blood and a failure of blood to move forward. Backflow from the ventricles into the atria is often heard as a murmur. Stenosis is when a heart valve becomes narrowed and stiff. This prevents the blood from moving forward. Prolonged stenosis causes ventricles to work harder to push the blood forward. This will cause the ventricle to become enlarged or hypertrophy, leading to either right or left heart failure. Impaired tissue perfusion, known as hypoperfusion, often occurs with hypotension. Impaired tissue perfusion, if it is prolonged, multiple systems can be damaged due to the lack of blood flow. Signs and symptoms will include chest pain, syncope or dizziness, arrhythmias, changes in the level of consciousness, decreased urine output, and lactic acidosis. Myocardial ischemia occurs when the blood supply to the heart is reduced. The heart muscle is unable to meet the body's demands by providing adequate oxygenation. Decreased blood supply to the heart causes decreased cardiac output. The heart then has difficulty pumping blood to the body. Signs and symptoms will include angina, neck or jaw pain, fatigue, nausea, vomiting, tachycardia, arm or shoulder pain, or sweating. Angina pectoris, also known as angina, is a symptom of coronary artery disease. This is caused by reduction in the blood flow to the heart. This creates chest pain and discomfort. This is due to a decreased supply of oxygen, making it insufficient to permit the heart to function adequately. Signs and symptoms would include chest tightness, squeezing sensation, and heaviness in the chest, burning, fullness or pressure, pain that radiates to the arms, neck area, jaw, shoulder, or back, sweating, known as diaphoresis, dizziness, fatigue, and shortness of breath, as well as nausea. Myocardial infarction. This causes irreversible damage to the heart due to a decreased oxygen flow that results in ischemia or tissue death. Signs and symptoms would include an irregular heart rate, diaphoresis, anxiety, lightheadedness, and chest pain that radiates. With an MI or myocardial infarction, rest and nitroglycerin will not relieve the pain associated. Supplemental oxygen is often necessary with cardiopulmonary issues to achieve the adequate fraction of inspired oxygen greater than 21%, which is the percentage in room air. Oxygen therapy is used to treat hypoxemia. Oxygen is a medication and must be prescribed by a provider. Supplemental oxygen can decrease the work of breathing and increase the oxygen that is available to the alveoli. Oxygen saturations need to be kept between 94 to 100%. Clients that have underlying illnesses their oxygenation needs to be between 88 to 92% to prevent hypoxemia. Supplemental oxygen can be provided in many different methods. A nasal cannula. This is prongs that is inserted into the nares. This delivers low concentrations of oxygen at 1 to 6 liters per minute. Humidification will help keep the secretions moist and easy for the individual to expectorate. A simple face mask is medium concentration of oxygen with a flow meter to keep and maintain the flow at a constant rate. This is based on the depth and the rate of breathing. The flow rate is between 5 to 8 liters per minute. A partial rebreather mask has a reservoir bag. Oxygen may be delivered at a higher flow rate of 10 to 15 liters per minute and a higher concentration of 60 to 90%. The reservoir bag must remain inflated to prevent carbon dioxide retention. A non-rebreather mask is similar to a partial rebreather mask, except for valves that go into the reservoir bag and holes in the mask. The valves ensure that exhaled gases are not returned to the bag. The oxygen delivered at a high flow rate of 10 to 15 liters per minute and a high concentration of 80 to 95%. A non-rebreather mask is not recommended for COPD patients or those with respiratory failure for long-term use because of oxygen toxicity. The Venturi mask has a fixed performance that delivers oxygen at high concentrations. The oxygen is delivered at a range of 4 to 10 liters per minute. An aerosol mask is used for nebulized solutions. These are medications that are changed from liquid into a mist form for inhalation, also known as breathing treatments. These medications may be corticosteroids to decrease inflammation and bronchodilators to open the airways. Positive airway pressure treatment is one of two methods. A continuous positive airway pressure, or a CPAP machine, has a hose and a mask or a nose piece that delivers a flow of constant and steady air, creating positive pressure to keep the upper airway open, and it keeps the alveoli open while increasing the amount of oxygen in the blood. The CPAP delivers a single pressure. A bivalve positive pressure airway, or a BiPAP machine, here the air moves through the tube into the mask that fits over the nose. The BiPAP pressures are higher with inhaling and lower with exhaling. This is recommended for airways that collapse with sleeping and causes difficulty breathing and decreased oxygen exchange. Oxygen toxicity, either acute or chronic, may lead to cell damage and cellular death. Cell damage occurs due to high partial pressures that cause oxidative damage to cellular membranes. This will cause the alveoli to collapse and can happen in as little as 24 hours when exposed to pure oxygen. Acute oxygen toxicity affects the central nervous system. Manifestations would include twitching of hand muscles, known as tetany. Prolonged exposure will lead to nausea, convulsions, dysphoria, and tinnitus, or ringing in the ears. A sputum specimen collection will assist in diagnosis and treatment of infectious pulmonary disease. Chest physiotherapy is a percussion of the chest, vibration, and postural drainage. This enhances the clearance and the drainage of secretion from the lungs. During postural drainage, the individual is positioned supine first, then prone with the left side up at 45 degrees, then prone with the right side up at 45 degrees, and then back to supine. Percussion is not done over the ribs, the sides of the chest, or the back. The breastbone, lower back, and spine are also avoided to prevent damage to any internal organs. An incentive spirometer will promote deep breathing. This is a disposable device that contains a mouthpiece and chambers to provide visual feedback on the amount of inspiratory volume that is realized by inflating the lungs and sustaining that inflation. This will decrease the risk of atelectasis. This device is used for 10 repetitions per hour, with each breath being held for 3 to 5 seconds. Pursed-lipped breathing is a technique to help with breathlessness. This can be used in stressful situations, exercise, and labor-intensive activities to alleviate shortness of breath and encourage relaxation. A flutter valve is used for breathing therapy. It can make it more comfortable and easier for the individual to clear mucus to help reduce and prevent atelectasis and reduce air trapping in the lungs. This will assist in coughing up mucus to clear the airway. Coughing and deep breathing will assist in clearing the lungs of mucus and pus and prevent atelectasis and pneumonia. Huff coughing is inhaling air and holding it. This allows the air to propel the removal of the mucus from the lung walls and then be expectorated. Forcefully exhaling permits coughing mucus out of the lungs. This is not as forceful as regular coughing, therefore individuals will not become tired and this will work better and easier for them. This comparison is the same as exhaling onto a mirror or steaming up a window. This huff coughing is used in a cycle of 4 to 5 huffs to clear the airways. Suctioning clears the airway and prevents respiratory infection complications. This is performed through the mouth as oropharyngeal, through the nose, nasopharyngeal, through the tracheostomy or the endotracheal tube. For oropharyngeal, this assists to clear secretions from the mouth and the pharynx by intermittent suctioning. A catheter is simultaneously pulled back and rotated in the oropharyngeal area for 10 to 15 seconds. In the nasopharyngeal suctioning, this is a flexible suction catheter that is inserted into the nares and then into the pharynx to help clear the upper airway. With tracheostomy, a trach tube is a long-term airway management system that is inserted into the trachea through a surgical opening in the front of the neck below the vocal cords. 2 types of suctioning can be performed. One is an open system suctioning. This is a single-use, unsheathed suction. Closed system suctioning. This is a catheter in a sheath that is used to suction quickly without interrupting the ventilation. Trach care is performed every 4 to 8 hours or PRN as needed. Closed chest drainage. This is a chest tube that is inserted into the pleural or mediastinal space of the thorax. This is used to drain blood, fluid, or air, and the goal is to facilitate lung expansion and restore normal intrapleural pressure. Following insertion, the chest tube is connected to a 3-chamber drainage system. The first chamber is a collection chamber. The second chamber is a water seal chamber. This allows air to exit the chest during exhalation and stops air from entering with inhalation. Sterile water is inserted into that chamber and is assessed for titling. The absence of titling indicates normal intrapleural pressure has been reached and that the chest tube may be ready for removal. If the water in the chamber is continuously bubbling, then an air leak is more than likely present. The third chamber is a suction chamber, either wet or dry suction. For wet suction, the chamber is filled with sterile water to the appropriate level for the suction prescribed and then attached to wall suction. Gentle bubbling in the chamber will be visual to ensure proper functioning. When caring for a chest tube or a chest drainage system, a nurse will assess vital signs, breath sounds, oxygenation status, and respiratory effort. This will ensure that the nurse will ensure that the drainage system is positioned below the chest and the drainage tubing is not kinked or occluded. The nurse will confirm the connection between the chest tube and the drainage tubing is intact and secured with tape. The nurse will monitor the water seal and the suction chambers to ensure proper functioning.